Now the second component, so this is the first component, which is having a good bone structure. The second component is the soft tissue. So that's the skin, the fat, and the muscles that go over the jaw. Now, if a patient has thin skin and not a lot of sub-Q fat, and sub-Q fat is really the differentiator here. Let's say like this piece of paper, thin skin, you will still see a really sharp angle because the thin skin just drapes a little bit over the jaw, doesn't blunt it. But if someone has, even with a nice bone structure, if they have soft tissue that is heavy with a good amount of subcutaneous fat, you see like this thick blanket, you see we put it over here, doesn't have that same sharp angle that the thinner soft tissue does. But now if a patient has thick soft tissue, like a lot of subcutaneous fat and maybe some sagging skin, as we see, if we drape that over even a nicely shaped bone, we still just don't see the definition. So for these patients, good bone structure, we need to reduce the soft tissue with probably a deep plane neck lift to tuck it up, pull it tighter, and then we can start to see more definition along the jawline. Going back to this guy who doesn't have a great bone structure. Now, even with thin skin, not a lot of subcutaneous fat, we can drape it over. It's still probably not going to show a lot of definition. This person, if they want to see a more defined jawline, need to probably add some structure with a jaw implant to help it stand out and look angular.